We're back. Here we are, Night Brothers commentary coming to you with our first episode back after the coronavirus pandemic. Both Matt and I were doing a little, I guess you call it self-quarantining for the last couple of months. We've started to sort of merge our groups together and gotten back to some semi-normalcy over the last couple of weeks, but I had to put the podcast on hold for a little while we were all kind of isolating in our homes. So we're happy to be back. We're happy to bring you some new and exciting content. Matt's got a really cool document built out for us to walk through today around that very topic of coronavirus and COVID-19, the pandemic that we've been living in for the last couple of months. Always unique to get Matt's take on this stuff. And without further ado, let's go ahead and dive in. Matt, why don't you kick us off?
All right. So today we're going to be talking about COVID-19, the coronavirus, what have you, and more specifically, how I think we should potentially reopen the economy, because eventually it's going to have to be done. Eventually, businesses are going to have to come back. People are going to have to go back to their jobs in order just to really kind of not only attain a sense of normalcy, but also just I'm trying to think of the right word here.
Yeah, I mean, I think at the end of the day, and this is a cliche old saying, life must go on.
Yeah.
I mean, we have to be able to come out on the other side of this. And I don't think that there's ever going to be a time where we know that we're out of harm's way, right? It's not, excuse me, I'm sorry to cough there. It's not so black and white. We're going to be operating in the gray because, these things are just challenging, and everybody's game plan, both personally and professionally, whether it be corporate world or, in your home life and family, everybody's game plan is going to look different based on their set of circumstances, right?
Yeah.
If you're in a high outbreak area and you have underlying medical condition or you're elderly or something like that, then you're probably going to take a more conservative approach. And similarly, if you're younger, in good health, in an area where it hasn't been as prevalent, you're probably ready to get things back going. And I think we have to be willing to accept that ultimately the individual's got the right to choose what's best for them in their life, as long as they're not putting other people in harm's way. And I'm sure that's some of what this plan is about. I can already see that you've got some of those things listed on here. So there's no perfect plan. Everybody's going to do their best. And that's all you're doing here is trying to recommend what you think makes the most sense. And I'm excited to hear about it.
Yeah. So basically, this is a 3-phase plan for states that don't have a whole lot of reported cases or reported deaths. This plan, I want to clarify that this plan is not for states like New York or any other areas that have a high number of cases, because those states are going to have to take a little bit longer in order to really, shall we say, start reopening up.
Right.
Because those states are really kind of in turmoil, really, per se, and it's going to take a lot longer for their situations to stabilize. So for me, I just want to clarify that this is only for states that don't really have a whole lot of cases.
And that's a good clarification. And it goes back to what I said before. You got to manage to your circumstance.
Yeah.
Right? If you've got a broken leg, you're probably not on the squat rack, right?
Yeah.
I mean, it really can be, again, I'm not trying to be flippant about a very serious topic, but you have to be willing to address things differently based on the circumstance that you're in.
Yeah. Yeah. So starting off with the first phase. The first phase I actually had starting in May, this month. And basically, strict social distancing is still technically in place. Only essential travel is allowed, and like hanging out with family and friends is still kind of discouraged.
Yep.
Most non-essential businesses should be able to reopen, but all employees must wear masks, wash their hands or use hand sanitizer at least 1.5 hours. Try to maintain social distancing, like being at least 6 feet away from other coworkers.
Yep.
Try to engage in working from home for at least two days a week. And then basically all of the following, which is like schools, bars, larger venues like movie theaters, churches, amusement parks, sports arenas, etc. All of those will remain closed.
And that's in the first phase.
Yes, that's in the first phase.
Yep, makes sense.
Now, the second phase is basically, there's a lot more freedom involved.
Yeah.
So more non-essential travel can resume. When people want to go out in public, they should avoid settings with people with at least more than 50 people and still using social distancing just to be safe. But then schools and daycares, bars, larger venues, like I mentioned before, all of that can actually reopen. But the second phase starts in July.
Yep.
Yeah.
So, and you're saying, and I think it's important to note on here, you didn't say it, but I'm going to call it out. They're able to reopen. They don't have to reopen if they don't want to.
Yes.
And that's again, the freedom aspect of this, that you manage to your circumstance. If you want to open, you feel comfortable putting in those, guidelines, and your employees are comfortable, practicing those social distancing best practices, so to speak, then by all means you should be able to open. But if you're not comfortable with it, don't do it. And I think that that's fair.
Yeah. And basically the third phase is just a return to normalcy. And that will be in September.
And when you say a return to normalcy, I'm just trying to clarify between July and the second phase. So, how do you see that playing out with those larger venues, theaters, churches, ballparks, et cetera? Is that a phase 2 July, or is that a normalcy phase in September?
Well, here's the thing. I would say for like ballparks and amusement parks, that's technically phase 2. But there can be no more than like 50 people within a certain radius.
Yeah.
But with phase 3, that's basically when everything returns to normal.
Okay. I'm just curious because, we've talked a lot on this podcast about sports and things like that. Where you think, or what you would recommend around some of the sports leagues getting their seasons back started, and whether that's with fans, without fans, et cetera. We just saw, UFC had 3 fights in the last week, all without fans. NASCAR ran its race without fans yesterday. The PGA Tour is going to start on, I believe, June 11th. No fans. I'm just curious how you see that evolving with some of the other major sports leagues.
Now, that's a good question. I would say, with regards to baseball, I would say for them, that I think from what I've heard, I think it's going to be July. They're going to do a shortened season in the main ballparks, but I don't think there's going to be any fans.
Okay. And
personally, I think there shouldn't be fans until, I would say, maybe August at the earliest.
Okay.
But that's just my personal opinion.
Yeah. And that's the hard part, Matt. And that's why I asked you, because, you're starting to see all these things. And the initial reaction is, I shouldn't say that. I don't want to overgeneralize. I think a lot of the feedback from fans has been, we want sports back, and we'll take them any way we can get them, whether it's fans, no fans, however it looks, they want them back. And I think by and large, you'll see the leagues do everything they can to safely reopen.
Yeah.
Right?
Yeah. And they should.
I totally agree. I guess what I'm curious about, and just getting your opinion, is because I think we're in agreement there. They're going to come back at some point in time, probably over this summer. The leagues are going to do everything they can to make it as safe as possible for everybody involved, whether that's the athletes themselves, the coaches, the trainers, media personnel that are there, the limited that will be allowed. When do you think we will start to see actual fans be allowed to congregate? What is it going to take? I've heard a lot of people say, well, we have to wait till we get a vaccination. And I'm like, okay, but when might that be? And
that will take a while.
And once you even have it, how do you know everybody's going to take it?
Yeah.
I'm a relatively healthy, knock on wood. I think I'm pretty healthy, young adult, and I've never gotten the flu shot. I don't really worry about that too much. Have you gotten the flu shot before?
Honestly, not that I can recall.
Yeah, so I guess I'm just curious. I'm just curious how this looks, and when are we going to know? Because I don't know if we will.
I don't think we will either.
And that's tough. That's tough.
If I had to guess, I would say probably late September, early October at the earliest.
Yeah. So you think there's a realistic possibility that by the end of the 2020 NFL season, we might see fans in the stands.
I think so.
Okay.
And again, it also depends on the states and
Yeah.
how bad and how many number of cases they have and like what the situation is at that time. So for states like New York, I would say probably not.
Right.
But for a state like maybe Georgia or Indiana, perhaps,
Yeah.
I would say we could potentially see it.
Yeah. And I hope you're right, Matt. And I don't say that selfishly. Of course, I would want to go to games, but I do also think that there's power in getting back to some sort of normalcy and not letting so much fear drive.
Kind of dictate our actions.
Yeah, dictate our. I mean, at the end of the day, and again, I'm not a doctor. I don't pretend to know anything more than what I am able to consume, through various outlets. What I would say is this: is as an individual, anytime I've made decisions out of fear, they've typically been not the better decisions I've made in my life. When I let fear drive my ship, so to speak, I typically don't. It doesn't result in very fulfilling outcomes, and I think a lot of people have probably gotten a little bit of what I would call paralysis by analysis over the last 6 to 8 weeks, where we've analyzed this thing, every which way that we possibly can and paralyzed ourselves, when in reality, any one of us can walk out the door today and, get struck by lightning, hit by a car, whatever it may be, collapse from a heart attack. I mean, it's all those things are risks that we live with every single day.
Yeah.
And so at a certain point in time, I think we have to be willing to, have a little faith and accept that every time we do anything, we're taking that risk, and just hope that you're doing everything you can, like you've outlined in all of these phases, and you've done a great job. Every single phase you are outlining social distancing, applying these best practices. If you can wear a mask, wear it. Gloves, wear it. Wash hands, 6 feet, etc. I think we all have to be able to do those things and get back to living our lives at some point.
And I agree.
So
But it also depends on really a lot of factors, like your age, your general physical fitness.
agreed. I mean, Matt,
Because for someone like our grandparents,
that's exactly where I was going to go. Is that Matt and I have grandparents who are elderly, and are definitely in a higher risk category, and so you have to be willing to, counsel those individuals and say, let's maybe have your phase back to normalcy look a little bit different. It's probably a little bit more of a conservative path. And I think that's being responsible.
and I agree.
And here's the thing, I think we have to think about that in the context of, okay, that's our grandparents. And when they get back out in the world, it's not really, I'm not so much worried about their actions. I know they're going to try to be responsible, and I know that I, as an individual, would want to be responsible for them. It's everybody else that's out there. And if you loosen the reins too quickly, you may have people start to disregard best practices around social distancing too quickly, and that's what's going to put everybody at risk.
And I agree.
Yeah.
And that's probably what's going to bring the whole pandemic back up to like just horrendous levels.
Yeah, I was going to say, I now that we've gone through this, I don't think this is, unfortunately, and I'm not trying to be pessimistic, I'm just trying to be a realist. I don't think this is the last time we're going to see something like this.
I agree.
And to me, it's unfortunate, but I think it's the reality of the globally connected world that we're in right now, where, in a couple years, if coronavirus is in the rear view and we're a couple years removed, people aren't going to be thinking how they are right now. They're going to be going back to their lives as they normally would, traveling around the world. And, we saw how quickly this came to be, starting in a place that I would say most Americans, the 95% Americans, had never even heard of. I'd never heard of Wuhan before this. And so, it's a disease born out of a place that might as well have been on Jupiter for all I was concerned. And sure enough, it's affecting, our neighbors essentially.
Yeah.
And so we've all got to be more conscious of whether it's hygiene, self-care, staying home when you're sick, washing your hands. These are things that hopefully we can program into our behavior without losing our ability to live a fulfilling life and have the freedom to enjoy the things that we all love to do, like playing golf or going to a Colts game or a Pacers game or Virginia Tech or whatever it may be. Would you agree with that?
Yeah.
I just think we're in such an unknown, guys, that it's really hard for us to come on here and say that we've got the answers, and I don't think we've ever claimed that we did. I
always try to say that I don't.
Yeah.
I just say, here's a plan that I've come up with based on my research.
Yeah.
And what I think could potentially work, but that doesn't necessarily make me right or wrong.
And again, what I love about your plan, Matt, and our conversations is that I feel like every time we get on here, if you turn on, well, let me put it this way. If you look at the general national conversation, and it's always interesting, you've got about half the states, red states, that are open, and you've got about half the states, blue states, that are still closed and putting down further lockdowns. And if you go and listen to, the quote unquote experts, you've got a bunch of people saying that, oh, it's nothing. I'm not wearing a mask. I'm not, wearing gloves, etc. This is overblown. You've got another crowd of experts saying, wear your masks, isolate, stay in, etc. And the reality is that there's probably a middle ground that needs to get a little bit more attention.
Yeah.
And I think that that's what you've highlighted here, which is let's not live in complete fear, but let's also not be so ignorant about our behavior that we throw everything out.
Yeah.
Right. So this plan to me is a perfect marriage of a responsible conservatism around social distancing and having set timelines and opening things that only need to be open on those timelines, but also not being so fear driven that we say, well, we don't know. We could be in this for the next 3 months. This is a clear step-by-step plan for how we can try and get back to having some more fulfillment, interacting and being social and doing the things that we all love to do. So I really like it.
Yeah. And to be fair, I will be the first to say that this plan, if it was ever enacted by any state government, could blow up in their face.
Yeah,
it really could.
No question. And Matt, that's trying to be a leader in this environment where it's unprecedented.
Yeah.
There is absolutely, and that's why love them or hate them. And I'm not going to get into that. That's why when people just go on and crucify Trump, or even when Trump crucifies, other people on the left, it goes both ways. Can you really definitively say that they should have known better? Nobody saw this coming. You know what I mean?
Yeah.
Right or left. And I'm not really in the business of trying to make an example out of anybody, regardless of a political affiliation. This is an unknown. And, at least it was to the general public. Maybe there were medical experts that saw this coming. But I don't think you and I sitting here ever would have predicted that we would be living in something like this.
Yeah. I don't think I could have predicted it.
No. And so to sit here, it seems to be a waste to me to try and really crucify somebody for just trying. And that's what this plan is to me. Like you said, it could blow up, but it's an attempt. It's just one option. And I like it. And I think we need more people throwing out ideas and opinions and just saying, hey, I'm here to help. And that's kind of that's what a lot of what this podcast has been about over the years, is just trying to offer specifically Matt's take on things, because he does such a good job researching and, setting political bias aside. I really like it. And I always think it's a refreshing take. So what else do you have to add, Matt?
I would say probably the thing that I really want to talk about is something that is reoccurring in all phases.
Yeah.
So basically, you're going to have robust testing.
Yep.
You're going to have You're going to have all military bases and non-essential businesses, factories, etc. You're going to have to try to stagger some shifts so that way you can try to keep workers at a safe distance.
Yep.
So that way we don't unintentionally spread the virus. There's going to be restrictions on mass transit.
Yep.
So, for example, there's probably no more than I want to say 10 passengers per bus or train car in the first phase, and then 50 for the second and third phases.
Okay.
Yeah, and I would say probably the final thing is just isolation. So anyone who has tested positive and is not really kind of gotten over the proverbial hump, so to speak.
Yeah, still symptomatic.
Yeah. Or people who have a fever, frontline healthcare workers, because they're constantly being exposed on a daily basis.
Yep.
And honestly, I would say just a lot of public alerts and just mapping to help inform the general public of where the new cases are, if there are any, which there probably will be, if I'm being honest with myself.
Yeah, well, there's going to be more cases.
Yeah.
We know that. It's inevitable. It's just how can we make two things true at one time? And what I mean by that is how can we minimize the number of cases going forward and limit the exposure for loss of life, while also, allowing those who are healthier or in good standing health to achieve some sort of
normalcy and just kind of getting back to doing what they will love to do.
Yeah. I am curious about asking you about one thing, and maybe this will tease a future episode that we can talk about technology and things being used in this time of crisis. But, you talked about public alerts and mapping to inform the general public of the location of the cases, right?
Yeah.
And one of the things that I saw come out a few weeks ago in regards to mapping was that I believe it was Google was actually mapping people's behavior. So they were mapping, not necessarily sending individual data, but they were collecting the movement of all the people and passing that data along to see how people were responding and adhering to social distancing guidelines, meaning they were identifying people who were leaving their homes and going out to a store or a park and basically compiling all this data that they could turn over to the state and say, hey, your state's either cooperating with social distancing or you've got some people that aren't. I'm just curious, at first blush, your thoughts on leveraging technology like that. And again, maybe that teases another episode for us.
I mean, that is a really good question. But for me, I would say, given the circumstances, I would say that can be both a good or a bad thing.
Yeah.
I mean, for a state like New York, that's absolutely a good thing because given the high number of cases that New York has, giving that information to the state government is absolutely essential. So that way they can just at least try to help, shall we say, maneuver through this crisis in a way that that has the smallest impact on the general public.
Yeah. Limiting risk of human loss. Yeah. And I understand that, Matt. I'm going to disagree with you, and that's okay.
And that was the thing and that's something I wanted to talk about. Because with regards to having that information, I mean, one could say that it is a massive invasion of privacy.
And that's where I fall, is that,
in a way, it's both. It's really both.
Matt, I totally understand your argument. Completely understand it. And because at the end of the day, it's a pretty fundamental argument that we can use technology to save lives. That's the premise of that side of the argument.
Yeah.
And if that's all that I thought that it was, I would be okay with it. But it's just a very slippery slope. You understand? Because then it becomes subjective to now the ends justify the means based on somebody's opinion, right? And that's where it just, to me, gets a little dicey, because
the rights of the individual are not necessarily being respected.
They certainly are not. And that's where my, I guess, trepidation with that comes in, is that, and I'm all for doing what we can to try and help the cause,
But you also
you got to play within the rules of the game.
Yeah.
And the game, so to speak, in America is basically the rules are written out in the Constitution. And that's, as soon as you start breaking those rules, then we're playing a different game. And I'm not sure I want to be a part of that game, even if it means, that the potential might be greater for exposure to something like coronavirus or future pandemics. So it's just an interesting thing. And I'd be curious, any of our viewers that have an opinion. Again, on this show, we never claim to be right or wrong. We just claim to be willing to talk about it.
Or at the very least, we claim to have an idea and are willing to share it with you.
And have a conversation. And that's what this has always been about from the beginning. So, anything else, Matt? Any other thoughts?
Nope, I think we're good.
Okay, well, guys, we appreciate you tuning back in after a month or two off during the COVID pandemic. We hope everybody is staying safe, staying healthy to the best of their ability. If you have thoughts and feedback, let us know. Matt, you will post the plan, a copy of the show notes with the plan?
Yep.
Okay, so you'll be able to access that if you want to check it out. And until next time, this has been Knight Brothers Commentary. Thanks, guys.